Now don't have a relationship that is bad with the toothbrush. Don't leave the toothbrush. Because the more you leave it, the worse the teeth become. Remember, we are also thinking about the baby you are carrying.
Oh yes, we are too.
Yeah, you are too. So we have to protect you and protect this baby.
Hi, welcome back to the Mamatoto Lounge. We are at the Kisumu Premier's Hotel. Have you ever thought what happens behind the camera? We are so glad to always bring you the real show, courtesy of Chanuka Studio. They are at Kondele. I am your host, Shikari Rosemary, who is your doula and your lactation specialist. Thank you so much for your subscription. We are moving. Continue commenting, sharing, and let us know who or what you want to listen to next. Now, a special guest today, something that you are not anticipating, but guess what? Pregnancy, and oral hygiene. What do you do? Today, our guest is none other but Daktari. Karibu sana. I will not mention your name. Please tell us your name and who you are and what you do. Na karibu sana. We are so glad to be with you.
Thank you very much, Shikari. Thank you for welcoming me to this show.
Yes.
It's in a very good location. This is a very wonderful place. Nice setup and everything. Yeah? So I'm Dr. Shem Rakewa. I am a dentist. People say we remove teeth, but we do so much more. So today I want to tell you what I've done. I'm a dental health specialist. I have done public health as a master's level. I'm currently a resident of oral and maxillofacial surgery. So I've done teeth and I know teeth and so much more. So It is nice and enlightening what you are doing. And we want to demystify so many myths, that are there about pregnancy, children, and their oral health.
Yes.
So this is a welcome show at a timely moment.
Thank you.
Yeah.
Thank you so very much. I wish we'd go deep and deep and deep, but there's always a beginning.
Definitely.
So Doc, working with the pregnant women, and one thing that I know during the first trimester is we hate the toothbrush.
Yeah.
We hate it and we hate it and we hate it again. There is already nausea.
Yeah.
Then there is associated smell of onion that you don't want.
Yeah.
Then now you don't want the smell of and the taste of a toothpaste. And the moment you're going to brush your teeth, mostly it's morning, when you already have morning illness, sickness.
Yeah.
So what should we do?
Now, you've asked a very big question, and it's very important. Very important. So you said the word hate. I think it's too much.
Yes.
So don't hate the toothbrush.
Okay.
Yeah. So don't hate the toothbrush. First, transfer the hate to hormones. You have to blame the hormones.
Yes.
Let's not take the blame as the ladies who are pregnant.
Okay.
So let us transfer the hormones. Transfer the blame to the hormones. Once you've transferred the blame to the hormones, then they take over that. And now you are left as a person, either Shikari, Anne, Lydia, you are that person now.
Yes.
Now don't have a relationship that is bad with the toothbrush. Don't leave the toothbrush. Because the more you leave it, the worse the teeth become. You can get other ways of doing it. You can do it gently, but don't ghost the toothbrush. So if you want to go, the take-home message is do not ghost the toothbrush.
Do not ghost the toothbrush.
Do not ghost the toothbrush, because it's so important. Do it even for 5 seconds after every meal, but do not ghost the toothbrush. Now, after we have accepted that we are not ghosting the toothbrush, then now we move to the other methods. I've puked in the morning. Do I brush immediately? That's the question. The answer is no. Don't brush immediately. You can gargle water immediately so that your acidity goes down. Because when you puke, it's an acid.
Yes.
It is corroding your tooth.
Okay.
Now we said we should not ghost the toothbrush, but this is not the moment to rush in with your toothbrush.
Yes.
Yeah?
Yes.
So it's a whole interplay. So first of all, the simple things. 1, you become a friend of the toothbrush. 2, you decide when to use it. how long do you want to use it? You don't want to use it for more than a minute now. You just want to pass it there, and within 10, 15 seconds before your body reminds you that it's supposed to be puking time, it's out.
You're done.
You get?
Yeah.
Now, in the moments that even the 5-10 seconds is not possible, you are not condemned yet. You can now replace it using a mouthwash, which you like, the flavor you like.
Oh, yes.
You can choose the flavor you like. There is a whole myriad there. So,
that has actually done such a big favor to us.
So there is a whole flavor. You can always pick one. You can pick strawberry, whatever, and buy it and put it there. Now, instead of brushing immediately, gargle immediately.
Wow.
Are we together?
Yes.
Yeah. But also, as a lady, I know you have those nausea and all, yeah? Don't you think you can use gum?
Some can, some cannot.
Yeah. Now, if you can use gum, choose the sugar-free gum, and instead of brushing immediately, chew the gum. And now again, the gum come in different
flavors.
And you choose the one that you
can contain.
Yes. So let's not fast.
Let's
not ghost the toothbrush, and let's love it. Then in cases that we cannot have a perfect relationship with the toothbrush, let's bring in the sides to the toothbrush. Let's use salty water. Yes. Let's use warm water rinses, good mouthwashes, sugar-free gum of your taste.
Yes.
Yeah, because we really want your gums to be okay.
That is deep.
Yeah, definitely.
I actually never thought about a gum, which is amazing because I think growing up we were told a gum is not something that is very good.
Yeah, gums, the cheaper gums, the gums that are easily available are definitely not good for your health. And that's why I said sugar-free gum.
Sugar-free gum.
Yeah, you can remember I said that.
Yes.
So we have to think about the sugar-free gum as the substitute. You have to take
when the worst comes to the worst.
Yeah, the worst comes to the worst.
All right.
Yeah, so in the main thing we want to talk about here, about brushing and taking care of your teeth as a lady who has nausea.
Yes.
And who has this nausea and vomiting. We want to think about not ghosting your toothbrush. We want to think about substitutions, and we want to think about protecting your teeth after the puking episode. So you gargle warm water to stabilize the pH.
Wow.
Yeah.
I am just wondering, Dr. and thank you very much, what happens if all this is omitted? That means my oral health is not up to.
Definitely. So you see, as a lady who is pregnant, everything is working overtime.
Oh yeah.
Yeah? And your immunity, with the guys we were blaming in the first question, the hormones, they are also overtime. So immunity is also relatively reduced.
Yes.
So this is the moment that bleeding gums comes up. If you had a cavity, that's when now it flares up. So any problem becomes double. Yeah?
Yes. And it fastens very fast.
Very fast.
You sleep without a toothache.
And then you wake up with a toothache.
Nobody will settle in that house.
Yes. So in the first trimester, this is the moment we really don't want to do much. And the last trimester. You remember? Yeah, and then you said there is a honeymoon moment.
Yes.
Yeah, the moment you are also calling the Goldilocks moment.
The Goldilocks moment.
Yeah, those two moments, that's the middle point, the middle point of pregnancy.
Yes.
Yeah, that is the point we want to do so much. But remember, also nowadays we live in a planned world. We live in a planned world. And pregnancies are becoming planned.
Yes.
So when you are going to your gynecologist to plan this pregnancy, or you are going to your doctors to plan this pregnancy, why can't you also include a dental visit?
Hey, doc.
Why not?
You're the best. Have you heard that? So that's a take home point number 3 that states when you're doing your pre-pregnancy planning, why don't you also visit your dentist? Because blame it on the hormone, they are going to flare up along somewhere here, and then everything will come crumbling down.
Yeah, definitely. And then you start to be ghosting the toothbrush, and we don't want
We don't
want to be enemies. Yeah.
Doc, I love the fact that now we are from here, now we are headed here. And is it because of the hormones that some of the procedures that I've heard women talk about are not done? I've heard this many stories of, oh, yeah, my tooth was doing my tooth,
Yeah.
my tooth. Then they went to the dentist, they couldn't do anything.
yeah.
They just told me, no, this one, we just give you something for the pain,
For the pain.
but we'll manage it after pregnancy. What happens?
Yeah, there are those fears. There are those fears, and we want you to think about just calm down. As the lady who is expectant, please calm down and let's feel the cavity.
Wow.
Are we together?
Yes, we
Yeah, because once you are calm, you are breathing normally, then the dentist, the good professional, should be able to pick any other thing that is happening along the filling procedure.
Yeah.
So there are so many procedures that are emergency. Do we deny you care? The answer is a big no. Yeah, but now, remember, dental care, we want you to have dental care all through.
Yes.
Yeah.
Yes.
So we started first by you planning your pregnancy and planning it, including the dentist.
Yes.
Unfortunately, you've not done it, but you are now developing these problems. There are those that we can do. We can do for you cleaning. We can do for you the routine filling. We can start a root canal. But now the complex procedures that would take too long on the dental chair, then we may not do. Remember, we are also thinking about the baby you are carrying.
Oh yes, we are too.
Yeah, you are too. So we have to protect you and protect this baby. So first of all, you have to calm down and let us do the filling. That is the most important thing. But also remember, there is the honeymoon period.
Yes.
You can do all these things mostly during the honeymoon period. Anything can be done.
Okay.
Remember, in the first trimester, we are scared of losing the baby preterm.
Yes.
In the last trimester, we are scared of inducing labor.
Yes.
You understand?
Yes.
But in the middle here, we are safe.
Well, we are calling it the honeymoon
The
stage.
honeymoon stage. Yeah.
All right. So it's a take home that ladies should not be afraid.
Don't be afraid.
And don't wait to hear the hearsays of don't visit a dentist at this time.
But don't you think that dentists work in hospitals?
They do.
And most, even if they are standalone, they have a quick number of a doula around.
Oh, yes, they do.
Yeah, so whatever happens, you are covered.
Oh, yeah.
You are covered.
Yes.
We also don't want you to stay around with bad oral health because this affects the baby. You can ask me how.
That is, let's go there. How does it affect the baby?
These are theories. They say they are theories. They say they are theories. But there are studies that have stated that when the lady carrying the baby is having extremes of dental aches, toothaches, and they have bad oral hygiene, bleeding gums, and that this also affects the baby, and you may end up with a child who is underweight.
Yeah.
Low birth weight.
True.
So all these are possible, and we don't want to allow this to happen to the child. Yeah. So please take your dental health seriously because it affects the baby.
That is very
true.
You don't because it's an obvious case. Like if I have any problem, I will not eat.
You wouldn't eat.
I will not even enjoy the pregnancy. There are so many things that will definitely pile up. That's
true. We don't want to.
We do not want. And definitely, a mother will do anything to protect the baby.
Definitely.
And even the fathers.
We try. we try.
So far, so good. I love the fact that we should, don't even think, I'm almost saying that dental care should be in the antenatal care package.
Yeah. Actually, it is. It is already.
It is already.
When you look at the current, the book you call the purple book.
Yes.
Yeah, it's called the antenatal clinic book and postnatal.
Yes.
There is a whole chapter the dentists wrote on dental care. I'm scared Kenyans don't want to read, but they should be reading. They are taught everything about it.
Today I'm caught.
Yeah, so it's there.
I've only seen the pediatric page, but I haven't seen Mama's page.
Go and read.
Today I'm caught.
No, go and read that. Go and read. Go and read. So you have to take care of our teeth as the pregnant mother.
Yes.
So that the ride of this baby is smooth till delivery. Let it not be a bumpy one, and let it not be so bumpy that the baby comes out very fast because of a toothache.
Wow.
So if you want to add another punchline, you can add that.
This one will be it will be a whole paragraph.
You just say.
Because now I'm thinking, because we are talking about the antenatal care, and there are some supplements that mothers are given for various reasons.
Yeah.
And I think the one that I want to touch on is about the calcium. Does it have any role, or if it doesn't, is there any supplement, and will there be a benefit?
Calcium on the teeth or on the health of the mother?
Or on the health of the mother.
The hormone, let's get deeper.
Okay.
You as a doctor, you'll understand it. But the hormone that control calcium level is called calcitonin.
Yes.
Does it selectively get calcium levels from specific areas?
No.
The deposits are everywhere.
They are everywhere.
Everywhere.
Yes.
And part of the calcium deposits are in the jaw bones.
Yes.
And in the teeth.
Yes.
But unfortunately, the teeth became, they are reachable easily. So when your calcium levels go down, then you can easily attack the gums and get more calcium there. But these will be the last ones. These are very remotely. We really get calcium supplements. They mainly supplement the body, the child's.
Okay, the child's health.
Supplements, yeah. Because it's very rare for you to, as a healthy lady who is bearing a child, for you to have low calcium levels that you have to attack the bones to get calcium supplements from there. Yeah, calcium resources from there.
Yes.
So the calcium is mainly to help the child, not the mother.
Not the mother.
I'm still on the same. I'm out of experience. There are ladies who complain that whenever they are delivering, they lose a tooth.
Yes. I've seen them too. Yes.
But is it true?
Now that today I'm understanding, it's something that has been there. It has just been triggered way fast by the hormones.
Yes. It's nice that you explain it.
Hormones because these hormones are the hormones that are sustaining our pregnancy.
Yes. So please don't blame the pregnancy. If you want to blame the pregnancy, first get the dental care check beforehand, so that we know the cavities are there and we fix them, so that by the time you are delivering your baby, you don't blame the baby for losing
a tooth. I just look at my baby, instead of admiring my baby, I'm like, huyu alifanya meno yangu ikatoka.
Yeah, so that's what they go through. But ideally, if they do the preventive and they do what we discussed earlier, then I don't think any lady should lose a tooth because of a baby.
I can't wait to read comments and to hear authentic stories and filtered stories from mothers who have seen this, and even daddies who've seen their wives losing a tooth or teeth and probably blaming it on a pregnancy, or any time you are pregnant, you're feeling, no, I think I'm not doing quite enough for my oral health. So, Doc, as we wind up, sensitivity. Do we also blame it on the hormones? And if we do, how do we prevent it, or how do we make it better? Because some ladies will tell you, when I'm pregnant, I can't take hot food, or I can't take cold food, or there are some things that I can't eat, or there's a particular noise I don't want to hear.
Ladies are very sensitive.
Yes.
And we said anything that is bad, we blame it on the hormones.
Oh yes.
I'm sure there are Christians who say everything that is burdening our hearts, we send it all to the cross.
Yes.
Yeah.
Yes.
So let's blame it all on the
hormone.
Yeah. That's number one.
Yes.
Yeah. Let's blame it all on the
hormone.
On the hormones. Let's not blame the baby. Let's not blame ourselves.
Sure.
The second thing is, let's now go back to the science of sensitivity. Yeah. What causes sensitivity? Exposure of the parts of the tooth that were not supposed to be exposed. Like we were protecting the tooth. The nerves were protected well.
Yes.
Are we together? Then now, whatever was protecting the nerves has gone. So the nerves are exposed, and now you are sensitive. So that's the science. Are we together?
We are together.
Now we go to what exposed the nerves.
Yes.
What covered the nerves and what removed them.
Yes.
So the nerves are covered by enamel or the gums.
The enamel is the white part?
The white part.
Okay.
Or the gums.
Or the gums, yes.
Yeah?
Yes.
But now we are in pregnancy, a very short duration. In a very short duration, can you lose the enamel No.
No.
So you are together. But you can't because maybe you are puking and it eroded the enamel. So yes, there could be loss of enamel due to vomiting.
Vomiting, the acid you mentioned.
The acid we mentioned.
Yes.
So how do you prevent that? Gargle your water immediately and try and get something to replenish the fluoride that went away with the vomiting. We have taken that in.
Yes.
Now the second thing is the gum. The gum can go down during pregnancy because your oral health has gone down. So the gum also gets inflamed or infected, and it becomes shorter and smaller, exposing the nerves.
Yes.
So what can we do again? Protect the gums by brushing well and having our gargles. Are we together?
We are.
Now, finally, the problem is there. We were preventing.
Yes.
Now we have the problem.
It is here with us.
Now what do we do? So that is when you now can visit the dentist, or at home, you have your favorite toothpaste, the flavor you like. We are not choosing for you.
We are not you choosing.
We are not judging you.
Yes.
Choose any flavor that you like.
If baby wants strawberry,
Go.
I'll go.
If you like the one that has this mint, go.
Okay.
Get that toothpaste, but also please read. Look for it. Does it have anything written fluoride?
Fluoride.
So the main thing is not the flavor now, it's now the fluoride.
Ingredient.
If you can get fluoride in whatever flavor you love, take it home. Are we together?
Yes.
You can buy 5 samples and choose and go and try them. I know, ladies, you can buy all the 5.
Yeah, and the
Take
best
them
thing, they
home.
come from small packages.
Yeah, small
small,
package
small.
until you get the one you love, and then use it. Let's not use specific brands, the flavor that you love.
Yes.
The main thing is, does it have fluoride?
Yes.
Take a small amount in your finger after you've accepted that this is what baby likes. And even me, I like. And the hormones are not in the picture anymore. So you've taken a small piece. Which part is sensitive? It's here. Apply. Paka mafuta kwa meno. Apply the fluoride on the tooth.
Wow.
And if you are a lady who does skincare, you know you have to give it time.
Yes.
So don't apply and rinse immediately.
That's already reduces skincare.
You guys are skins. So yeah, you'd like to look nice. So I still think you do that.
Yes.
And even if you don't do, please keep on brushing your teeth. So now get your small amount of fluoride, put it there and leave it there. The time is 10 minutes to as long as you wish.
Okay.
Yeah. So after you do that, then it will go away. If it is persistent, now you can visit us. And now we can give you a higher concentration of fluoride or do something to control your sensitivity. I think that's all you can do.
Yes.
Yeah, but sometimes the sensitivity may be due to more.
Yes.
Now it becomes like a cavity. You would feel it. If it is more, we would feel it. If it is too much, we decide even to go away with the tooth. But I don't think that is something you want to discuss now about sensitivity.
So I think the best thing is when the sensitivity starts, it's even just good to come down there at Dr. Shem's.
Yeah,
like immediately, so that, because I may not know the level.
Yeah.
And remember, I am pregnant,
Yeah.
I am panicky,
Yeah.
I don't even know what to do or what length.
Yeah.
So, wow.
Yeah, so you can visit the dentist, but we are Kenyans. I know the first thing you want to do is to do a over-the-counter. And also you also
call a friend.
Yeah, call a friend, ask all those things. Now the friend, you who is the friend, should advise her to first get the toothpaste, apply, and then later if it persists, then you can visit us, Dr. Chef Dental.
Very true.
Yeah. So those things are there.
Hey.
We always have a solution for you.
Yes.
Yeah, there is
we will not stay home and use a herb. And there's a beautiful story. A lady told me that there's a particular cypress tree that they take, the husband chews, and then when she now applies it.
That is true love.
That's true love.
That is just an act of love. There may be no science there.
All right. So, Doc, what will be your parting shots or your 5 punchline from our discussion, or something that you've not mentioned, to the pregnant woman who is watching or who will watch this even in the near future?
Yeah. So, well, first of all, we want to talk about them. The first thing is we want to talk about pregnancy planning. So as you plan your pregnancy, plan with the dentist in mind. So visit your dentist so that your early cavities are picked and your gum disease is fixed. Number two, blame the hormones. Put the blame on the hormones, not on yourself, and ensure you don't ghost the toothbrush. Number three, if the toothbrush is not your friend so much, ensure you can rinse, mouthwashes, warm salty water. The rinse should be your favorite taste. You can use gum, and always try to maintain a good oral hygiene. Number three, there is the most important moment, the duration that you can take in anything, and that's the second trimester. That moment is when you can calm down and have your teeth filled. Number four, always visit the dentist when you are having any worries about teeth. And we are still open at Mega City, Dr. Shem Dental. And in Nairobi, we have the Platinum Dental Clinic in Langata. Thank you.
Beautiful.
Yeah.
You have now heard it from the doctor's mouth that pregnancy affects each and every part of the body. And for today, it was all about our oral hygiene. We do not want to blame ourselves and say that my body was not able to protect itself because it was generous enough to give the baby everything. We have something to unleash to, and that is the hormone. So please remember to subscribe and bring those conversations on, because Mamatoto Lounge is here for you. Thank you so much, Prenias. Thank you, Chanuka. And we are always here to guide and to answer your questions. Till next time, bye.